Now, before discussing about the management approach, let us first talk about the types of chronic renal failure and how can we categorize them by using glomerular filtration rate as a major parameter. So first, if we ask ourselves, how is GFR calculated? Well, GFR can be estimated from the serum creatinine using two different formulas. First up, we have this MDRD formula, which is the modification of diet in renal disease. So MDRD formula goes somewhat like GFR is equal to 186 multiplied by creatinine levels in the patient, divided by and powered by certain constant factors that you can see on the screen, multiplied by age, and then multiplied by more factors if the patient is female, and another factor if the patient is African American. So this is the MDRD formula, and do note it because you will be quizzed about it in your board exams. Now, another formula is the Cockcroft-Gault formula. In this, GFR is calculated by, first up, 140 minus age, multiplied by weight, then multiplied by a constant, which is 1.23, and then multiplied by factor 0.85 if the patient is female. Now, this all will be divided by creatinine levels in the patient. So this is how you can measure the GFR rate through the Cockcroft-Gault formula. So now that we have calculated our GFR, we are going to categorize our patient into different stages based on that. So in stage 1, we have the normal or high GFR rate, which is 90 milliliter per minute. And then we have stage 2, which tells us there's mild chronic kidney disease, in which the GFR is 60 to 89 milliliter per minute. Then we have stage 3A, which tells us moderate chronic kidney disease presentation, in which GFR is 45 to 59 milliliter per minute. Then we have stage B3, which is also moderate chronic kidney disease, in which GFR is 30 to 44 milliliter per minute. And then we move towards stage 4, which is severe chronic kidney disease. And the GFR is quite low. It is 15 to 29 milliliter per minute. And then we move towards stage 5, which determines end-stage kidney disease, in which GFR is less than 15 milliliter per minute. Now, any patient having even less than 15 milliliter per minute will have no other option but to have a kidney transplant. So keep that in mind. Now, you must keep in mind that the management criteria is also based upon these types or these categories that we talked about right now. And whenever you observe a patient of chronic kidney disease, you must follow a proper clinical approach. So you have to ask yourself, is it truly chronic? Because the GFR could also be reduced because of acute kidney disease. And then we have to treat any reversible causes immediately, like hypertension, infection, and obstruction. And after that, we have to assess the need for dialysis. And lastly, we have to treat all the complications that are resulting due to renal failure. So this is a clinical approach that you're going to take in the case of chronic renal failure patient. So now coming towards the management of chronic kidney disease. This obviously relates back to the stages that we talked about earlier and the glomerular filtration rate, which is GFR. Now this is basically divided into 3 categories, as you can see. First category we have in which the glomerular filtration rate is less than 15 milliliter per minute. If you remember, this signified stage 5 end stage chronic kidney disease, in which there's severe renal failure. And we immediately refer this patient towards a specialist. The second category is between 15 to 30 milliliter per minute of GFR. If you remember, this signifies stage 4 or severe chronic kidney disease. In this category, there's significant impairment of renal function. We immediately assess the patient and send them a referral to a specialist. Now we have the third category, which is 30 to 60 milliliter per minute of GFR. Now, this signifies stage 3A and 3B of chronic kidney disease, which was the moderate stage. Now, this range may reflect age and biological variation or renal disease. That is suggested by proteinuria, hematuria, and increased blood pressure. Now, we have to evaluate such a patient immediately and repeat evaluation after 1 week in unwell patients. And if the patient gets well, we have to evaluate them again in 1 month. Now, we have to refer those all with renal damage to a specialist. Remember that we must refer all those patients with renal damage to a specialist. So guys, we talked about the different stages of chronic kidney disease that are based upon or categorized upon glomerular filtration rate. Remember that we also studied about the 2 different formulas that are used to calculate this glomerular filtration rate based on the creatinine levels in the body. And then we looked over the clinical approach on how to manage and treat a patient with chronic kidney disease. So now let us move towards the management and the different treatments that we employ in the case of severe chronic kidney disease. So let us get started.